Thank you very much, Chairman Klein, for calling this hearing, and I want to welcome our witnesses to this hearing and look forward to their testimony. There have been many predictions about the new health care law, how the new health care law would affect our nation's economy. The debate has been heated. Misinformation about the law has bred fear and division among the public. I hope that we can put rhetoric and misinformation aside, that we will openly and honestly examine the law that is now in effect, but still have several years to go before it is fully implemented. The Affordable Care Act is not perfect. It does not contain everything that I wanted, and it includes many things that some of my colleagues oppose. That is the nature of lawmaking. But the new law has unquestionably begun to deliver positive results for small businesses, for large employers, for individuals, children and families, and the elderly. It has begun to work for small businesses. Dr. Odette Cohn, who runs a small pediatrics practice in Williamsboro, New Jersey, has testified in recent hearings that the small business tax credit is keeping her employees covered. Thanks to the lower health care costs, Dr. Cohn is hiring another nurse practitioner and upgrading her business with electronic record-keeping system. And she said that she's eagerly awaiting the creation of state-based health insurance exchanges in 2014, which will allow her to pool together with other small businesses to improve choices and drive down the cost just the way large companies do. And hopefully she will get rid of that 18% more she's paying for the same plans as large businesses offer. Dr. Cohn is not alone in benefiting from the new law. The recent Kaiser Family Foundation survey found that the number of small businesses offering insurance has increased by 30% this last year. The new law works for large employers too. Helen Darling, the president of the National Business Group on Health, that represents more than 300 large employers, including 65 of the Fortune 100, has said that our nation's businesses would be worse off if the law was repealed. The new law benefits working people. Workers are already enjoying new rights and protections that put them in charge of their health care. Never again will they have to worry about losing their health insurance if they lose or change their job or decide to start their own business. The new law is literally keeping people alive. More than 1 million young adults have been able to join their parents' health plans. Nearly 16 million Americans are no longer vulnerable to the insurance companies dropping them from coverage when they need it the most. That is, when they are sick. And 165 million people no longer are subject to the annual and lifetime benefit caps that robs them of coverage at the exact time that they need it. Children with pre-existing conditions are no longer denied coverage, and in 2014 the same will be true for adults. And the new law also works for the overall economy. Since President Obama signed the Affordable Care Act, 1.1 million private sector jobs have been created, more jobs than in the entire 8 years of the Bush administration. The Wall Street Journal recently reported that the IPO market is gaining momentum. 7 of the 11 companies going public last week were in the healthcare-related industries, taking advantage of the new opportunities to make healthcare more efficient with new technologies and new systems guidance. The Healthcare Act is now the law of the land, and it is working. It reins in the power of the insurance companies that have unfairly wielded over ordinary Americans' lives. If Congress were to repeal this law, small businesses, families with children, workers, and elderly would be harmed immediately. Their taxes would go up, their rights and benefits overturned, and their access to quality, affordable care taken away. I look forward to today's hearing, and I yield back the balance of my time. Mr. Chairman, I'd like to just take a moment before we get into the hearing. Today's hearing will be the last hearing for the committee's Democratic Staff Director, Mark Zuckerman. Where's Mark? Right here, right behind us. Mark will be joining the White House staff as the new deputy to Melody Barnes in the Domestic Policy Council. Mark has been a trusted advisor and a friend. Since 1996, Mark has been through every labor and education battle with me, helping to keep our promise to America's working families. Student loan programs are more reliable, workers are afforded more rights, patients are protected because of the work that Mark has done. I know his wife Polly and his children Naomi and Noah are as proud of him as I am, and that he's taking this next step on his journey. Thank you, Mark, for all of your dedicated service to the committee on both sides of the aisle and to the committee's work on behalf of families. Stand up for a minute. Just stand up.